Signs of a fatty liver. The liver is one of the most important organs in the body, and fact is, without a healthy liver, you cannot survive for long. This is why it is very important that you recognize the early signs of fatty liver disease so you can take the correct measures to restore the health of your liver. Before we learn about the signs of fatty liver disease, it is important that you recognize that fatty liver disease can happen to both alcoholics and non-alcoholics. So, put simply, fatty liver disease is just too much fat buildup in your liver. And it can take two forms, namely alcohol-induced fatty liver disease and non-alcohol-induced fatty liver disease. Now, let's take a look at the signs which indicate a fatty liver. Number 1, abdominal pain, particularly in the upper right side of your abdomen area, that is the right side of your belly. This happens because the excess fat buildup can cause your liver to enlarge and press against your other organs, and this discomfort can result in abdominal pain. Number 2, jaundice. Your red blood cells have a short lifespan, normally 120 days, and they are constantly made and broken down. Bilirubin is a substance that is produced from the breakdown of your red blood cells, and a normal healthy liver will readily remove the excess bilirubin. However, when someone has fatty liver disease, the liver is unable to remove the excess bilirubin from your body, and as bilirubin accumulates, it causes your skin and the whites around your eyes to look yellow, a condition called jaundice. If you develop jaundice, you should immediately go and see a doctor, as this condition can be very harmful. Number 3, extreme tiredness. The major reasons why people who have fatty liver disease experience extreme tiredness are inflammation and loss of liver function. Inflammation can arise because of the excess fat in the liver, and this can then lead to the release of certain proteins called cytokines, which can cause a person to feel extremely tired. Before we look at the other signs of fatty liver disease, it is crucial for us to understand the stages of fatty liver disease. As you can see in the picture, fatty liver is the second stage of the disease, and liver cirrhosis is the last stage. Fatty liver disease is reversible, but once your liver reaches the last stage, that is liver cirrhosis. Then, your liver loses all its functions, and the only option is to get a liver transplant from a healthy donor. So, now we are going to look at some of the symptoms of liver cirrhosis. The common symptoms are loss of appetite and edema, which means swelling of the legs and belly. Let's look at what causes the loss of appetite. Ghrelin is the hunger hormone, and as the name suggests, this hormone gives you that feeling of being hungry. When a person has liver cirrhosis, the ghrelin hormone is affected such that it becomes blunted and the person does not feel hungry. And as the person does not feel hungry and will likely eat less often, this also brings about weight loss. Another symptom that we mentioned was edema. Edema is a condition in which the legs and abdomen become swollen. This is because of excess fatty tissue. There is greater pressure exerted on the liver and in the veins of the liver, called the portal vein. And this increased pressure in the portal vein causes the accumulation of fluid in the legs and abdomen. Now that we have looked at the signs of fatty liver disease, let's take a look at the treatments available and also the precautions you can take to maintain the health of your liver. As harsh as it sounds, there is no single medication available to treat fatty liver disease. If you have been diagnosed with fatty liver disease, then your doctor will work with you to help reverse the condition, and often they focus on lifestyle changes which can help restore your liver back to normal. Some of these lifestyle changes can be avoiding alcohol, certain diet changes, maintaining a healthy body weight, and exercising regularly to promote good health. Some of the precautions that you can take to maintain a healthy liver is drinking plenty of water to make sure that you are hydrated and to improve the health of your liver. Decrease your sodium intake, that is, salt intake. This is because sodium causes water retention, and in the case of fatty liver disease, this can lead to edema or can worsen it. Include more whole grain foods and unsaturated fats in your diet. These foods are not only good for your overall health, but they will also help to improve the health of your liver. You can include whole grains such as oatmeals and whole wheat bread and pasta to your diet and consume these foods regularly. As for unsaturated fats, you can eat nuts such as walnuts, almonds, peanuts, and cashews, and fatty fish such as salmon and mackerel. Definitely try to include eggs in your diet. Eggs are the superfoods that can reverse a fatty liver. Eggs contain the nutrient choline, and this helps to burn fat. Eggs are also rich in vitamin B6, B9, and B12, and these vitamins allow your body to convert harmful inflammatory substances such as homocysteine and glutathione, which is a very powerful antioxidant and will help protect your body from damage by free radicals and promote a healthy immune system. Lastly, one thing you need to remember is that if you have been diagnosed with fatty liver disease, you should always consult with your doctor before making any changes to your diet and lifestyle. Your liver is an amazing organ, and if you implement all the changes advised to you by your doctor, then you will be surprised and amazed to find that your fatty liver disease can be totally cured.